Okay, good morning, everyone. Thanks for being here today. I am a supportive housing program manager with DSHS in our home and community living administration. And one of our supportive housing programs is called the Governor's Opportunity for Supportive Housing, or GOSH, which is the program that we're specifically going to be overviewing today. Please, it's not a huge group, but I might have a little trouble seeing the chat while I see my notes and the slides at the same time. So if I don't get to your questions as we go in the chat, feel free to unmute or raise your hand. I can also review questions at the end of the presentation. Um, I have a feeling we won't take the full hour and a half. So,
Audrey, this is Kimberly. I can monitor chat for you if that's helpful.
oh, yeah, thanks, Kimberly. I appreciate it. All right. As a little icebreaker, go ahead and put your name, agency, and favorite fall activity in the chat. You can see who's joining us today. Oh, all right. And while folks are doing that, this is our Office of Housing and Employment, or OHAE, our commitment to EDAI, equity, diversion, access, and inclusion, and service delivery. Our ALTSA Office of Housing and Employment is dedicated to offering housing and supported employment resources that honor client choice. We work to eliminate barriers and expand opportunities that align with each individual's vision for their own life, regardless of their mental health, substance use disorder, race, language, age, ability, or other status. As part of putting this into practices at our agency, we do not screen out resources. We offer all available resources to all clients. We remind our colleagues that our clients are protected by the Olmstead Act, which is federal law protecting the rights of folks who experience disabilities. We're committed to folks having the right to fail, the dignity of risk, and we continuously reevaluate our process and policy to improve these outcomes. We are in a little bit of an organizational time of change. Effective May 1st, ALTSA, or the Aging and Long-Term Support Administration, was renamed to Home and Community Living Administration. For some administrative purposes, the ALTSA name is still being used, particularly for FCS referrals. So kind of think of those interchangeably. Within Home and Community Living Administration, GOSH falls into the office or the Home and Community Services Division. So ALTSA, HECLA, or HCS all kind of point down to our team. So a little bit about our agenda today. First, we'll go over long-term care services, which is our set of services that HECLA HCLA clients have to be eligible for in order to receive GOSH. Then we'll go over GOSH availability, explain our supportive housing model, details about GOSH eligibility, learning the referral process, looking at the team roles, and go over some of the additional resources that are available to our clients on GOSH services. Okay, now that we've gone over some of these acronyms, the one that we haven't touched on yet is the AAA. That refers to the Area Agencies on Aging, which is a network of organizations throughout the state that contract with our Home and Community Living Administration to provide case management for long-term care clients who are living out in the community independently. Just to highlight some of our common acronyms here. This is a little bit of an organizational chart, just to review where our services fall. So Department of Social and Health Services, Home and Community Living is where our programs fall. And from there, we're down in the Home and Community Services division. That's where you'll find GOSH. So long-term care services always starts with an assessment by Home and Community Services team to see if the client is eligible, and if so, for what services. If the client is deemed eligible, then they can choose the path where they meet the receive services. So our clients are either able to say, I would like to receive my long-term care services in my home, where they live out in the community independently in an apartment, or they are able to receive services in a residential setting. So for most, that would be either an assisted living facility or an adult family home where the caregiving staff is there on site. In terms of case management, those folks who receive their services in their own home are case managed by our partners at the AAA. Otherwise, folks working for Home and Community Services case manage from the residential setting. How do clients qualify for Home and Community Services long-term care? There's two main categories that eligibility has to meet. One is the functional need. So clients have to meet a threshold of need with assistance of activities of daily living. So things like eating, bathing, using the restroom, getting around. Instrumental activities of daily living include things that aren't centered around the individual's mobility necessarily, but things like shopping to get groceries, completing your chores like laundry, meal prep. Those needs are assessed by a functional assessor. And there also has to be a financial need. So Medicaid, uh, you have to be Medicaid eligible, and there are some income and resource limits. Some clients who are on the threshold might be able to receive services, but required to pay a participation fee towards the cost of their care. These assessments are fairly complicated, and we have folks that just do that work. Everything is assessed on an individual basis. So I really encourage, any clients who you may have who could need that kind of assistance to apply and be assessed, because um, there really are lots of different circumstances, and our financial workers can make a good judgment on an individual basis. Okay, so when it comes to our functional eligibility assessment, the assessors are going to look at things that the client has needed assistance with and received assistance with in the last 7 days. So the functional assessment will look back at the last 7 days and say, did you receive assistance with eating? Did someone have to help you bathe, or did you not bathe because you weren't able to do so? Did you need help getting dressed? So on and so forth. But we do encourage folks to have advocates with them if possible during these assessments, family members, neighbors, anyone who may have actually been providing these supports. That's helpful to get their input. Sometimes folks are shy about reporting, what they received help with, wanting to, appear a little more independent than they might be. So it can be helpful to have those um, folks that are helping on hand for these assessments. Okay, the whole host of benefits that long-term care can provide um, is pretty vast, and we don't need to get into too many specifics here, but just know there's a lot of resources we have to support people in their home or in those residential settings. And supportive housing that I work with here is one of those services. For a lot of folks that are on long-term care services, personal care or having a caregiver is going to be one of the main resources that they receive on long-term care. So that's an easy way to think of it. That's not the only thing we offer, but the need for that in-home care is what prompts a lot of folks to apply for long-term care services. Okay, so before we get into the details about GOSH, this is a statewide map with a green star on each county where we're currently able to offer GOSH services. We contract with providers out in the communities, so anywhere that we don't currently have a green star, it doesn't mean there's not a need or interest in clients living there on GOSH. We just don't have a provider. So there's a little bit of information at the end of the presentation. If you or your organization is interested in learning more about becoming a GOSH provider, we are pretty much always looking for additional folks. As you can see later in the slides, we have a pretty big increase in participation in the program, so always looking for more. Okay, one of the foundations of the GOSH program is our cornerstone of Housing First. In the video that we're about to watch, you'll see information about Housing First model for how supportive housing work. And some questions to think about as you watch is, how does this model provide opportunity? What does this model do to promote client-centeredness? And what is Housing First not? Okay, so here's the big test. I believe I shared my audio. If there is a problem, would someone please unmute and let me know that you're not hearing the video?
Housing First has 5 key principles. If you're not following the 5 principles, it's not Housing First. Principle number 1, immediate access to housing with no housing readiness conditions. Participants meet with the support team once per week, but housing is not dependent on psychiatric treatment, abstinence, or other readiness conditions. And when we say no housing readiness conditions, we mean none. Now, many participants stay housed in their first rental, but evictions happen. With the support team's help, it's an opportunity for learning, adjusting, and the immediate chance to try again. Research shows Housing First reduces emergency room visits, hospitalization, shelter use, detox services, and incarceration. There are no common indicators that predict who Housing First will and won't work for. So given its effectiveness, let's focus on Housing First, then let participants tell us the next step. Principle number 2, consumer choice and self-determination. This principle highlights that participants want and can make productive change occur in their lives. But in order to thrive, meaningful housing options are a necessity, and research shows that a majority of participants prefer independent market housing throughout the city. Now, in order to foster learning and self-determination, it's important that the team support most choices participants make. Though the team can point out expectations, they should avoid overprotecting participants from learning opportunities. When choices have poor outcomes, a supported learning environment promotes more informed choices in the future, reducing long-term harm and increasing self-sustainability. Principle number 3, recovery orientation. People are more likely to do well and achieve personal goals when they have an opportunity to find their own recovery. Housing First relies on supporting people as they work at their pace towards self-defined goals, whether it's treatment, returning to work, or reconnecting with family. The addition of peer workers on the support team addresses power dynamics, increases safety, and models hope for both participants and team members. Finally, by building, following, and reviewing strength-based recovery plans, the support team can spend less time managing crisis and more time on the steps that lead to the participants' goals for recovery. Principle number 4, individualized and person-driven supports. Now, support is meant to fit the participant, not the other way around. People are at the center of Housing First. Therefore, the support team provides appropriate team members, approach, and tools that help each individual with their goals. Whether that's grocery shopping, working, adopting a pet, finances, therapy, or engaging with new communities. By replacing complicated policies with flexible models and a can-do philosophy, the team helps participants reduce long-standing systemic barriers, thereby improving self-determination, choice, and quality of life. Principle number 5, social and community integration. Moving to a new area can be a hard experience for anyone and can make you feel pretty isolated and lonely. The Housing First team can help participants build community connections based on their specific needs and interests. The team also fosters community development by providing landlords and community members with education on housing first, inclusion, and myth-busting negative stereotypes. And though supporting social and community integration may take time, it can go a long way in helping participants establish relationships and support networks within new communities.
Okay, so that's a pretty good overview of Housing First philosophy. To dive a little more specifically into our housing services, we'll take a look at this little house here. What is supportive housing with our GOSH program? We like to stay client-centered and put the individual at the center of all decision making. We provide home visits and 24/7 access to supportive services. We do provide immediate access to housing and support services. With the caveat, because we use a scattered site model, clients receive a housing subsidy to use in the place of their choice. They have immediate access to that subsidy. We don't have a set aside apartment for our GOSH participants that they go straight into. So I just put a little note there because it can be a little misleading. We utilize harm reduction and assertive engagement techniques, and the philosophy and evidence-based program is again rooted in that housing first model. Our supportive housing services through home and community services are not, like I said earlier here, limited to one building. We use a scattered site model for fair market apartment rentals. We are not an intensive behavioral health program. Our contracted providers are supportive housing providers. They're not behavioral health providers. We are not a substance use disorder program. We are not a compliance-based service. And our services are not time limited. Clients don't graduate from GOSH. They can maintain GOSH supportive services for as long as they would like to. All right, one of our most important principles is that we do not screen clients out. So of clients that are on our long-term care services, we maintain that our clients have the right to choose where they want to live. Sometimes there's pressure for our folks that are experiencing, a lot of difficulties. There can sometimes be pressure for those folks to choose a residential setting and go to an adult family home or assisted living. And part of our program's mission is to support this idea that our clients have the right to choose where they want to live. And even if they have a lot of barriers, that living out in the community, if that's where they want to be, ultimately will lead to more long-term success. We don't screen clients out for things like poor credit, eviction history, substance use disorder, not having any income, their criminal history, or stereotyping that they're not ready for housing. That is not a part of how we operate our program. So eligibility for GOSH. So first and foremost, they have to meet our home and community services eligibility. So they have to have had that functional and financial assessment and been found eligible. They also must be discharging or diverting from Eastern or Western State Hospital. So what that means is that they have either been ordered for treatment at one of the state psychiatric hospitals or put on a psychiatric involuntary hold at a hospital out in the community. So that would be what it means to divert from the state hospital. They also have to want to live independently out in the community and be willing to work with a supportive housing provider. Okay, a little more detail about that definition of a diversion. So someone has to be placed on a court-ordered involuntary treatment hold for 120-hour, 14-day, 90-day, or 180-day. These orders will come through a judge. And the client then also has to meet that home and community services eligibility for our functional and financial assessment. But that's it. As long as those two conditions are met, they can be eligible for a referral to the GOSH program. Just another visual aid here for our eligibility for GOSH. Either state hospital or diversion criteria has to be met. They have to have that assessment by Home and Community Services and be found eligible. They have to want independent housing and be willing to work with a supportive housing provider. And from there, their long-term care case manager or that person who did the assessment for Home and Community Services can make a referral. Here's just a little scenario. Judy is on a 14-day hold at a local evaluation and treatment center. This makes her eligible as a diversion client. Judy has challenges with medication management and remembering to take regular showers. Those are considered needs that would qualify as needs of activity of daily living needs. So Judy has a Home and Community Services case manager assess them, and she's found functionally and financially eligible for long-term care. She has goals to live independently and is requesting support to secure her housing. Is Judy eligible for GOSH referral? Yes, she is. So you can see that the client who is on a hold, they don't have to have been already on Home and Community Services to be eligible. They just need to, at that point, have the assessment.
Audrey?
Yes.
There's a question in the chat that says, recently we've heard they need to express interest in caregiving services to be eligible for MIST and GOSH. Is this correct?
No, that is not correct. That is kind of a hot topic in our office right now. There is a lot of, I guess, misunderstanding about that. What the client needs to, so GOSH is a long-term care service. So the client does have to be open on some long-term care service to be eligible for GOSH. But we have had some misinformation out in amongst our case managers that if a client is refusing other long-term supports, that they're no longer eligible for GOSH, and that's not true because our service is considered part of the long-term care host of services. So thank you for bringing that up. That has been, we've been working with our colleagues in other departments to try to clarify and make sure that that misinformation isn't continuing to spread. And we have intervened case by case on behalf of a lot of clients where this belief has kind of come up. But no, that is misinformation. So please reach out to me or a member of our team if you feel like there's been a situation like that and we can support you. Okay, you've been referred to GOSH. Now what? This next video will explore what it might be like for a client at the time they're referred to GOSH. As you watch, imagine yourself as this client. What are some areas you would most want support in? And what are some questions you might have?
You've been referred to GOSH. Now what? Your GOSH provider will start to work with you prior to discharge from the state hospital or community facility. They will work with you to understand your housing preferences and help you search for the housing that you want. Regardless of whether you discharge to your own home or an interim setting, your team of care will change once you are in the community. This can be overwhelming and confusing. This video is intended to help you understand the role of those on your care team. Your GOSH provider will meet with you frequently. They will help you make sense of all the different people you might be working with. They can also help refer you for other services you want, like supported employment. Once you are in your own place, your GOSH provider is there to help you keep your housing. If you have any concerns related to your apartment, for example, if you are having communication problems with your neighbors or landlord, get behind on rent, or your apartment needs repairs, it is important to let your provider know. Since GOSH is part of your ALTSA services, you will have a long-term care case manager. Your case manager will change dependent on which setting you are in. They are an important part of your care team and work in close partnership with your GOSH provider. They authorize any long-term services and supports you need. For example, modifications to your living space, personal emergency response system, or a deep clean of your apartment. To remain eligible for GOSH and to keep your housing, you need to remain eligible for ALTSA. Your case manager will conduct an annual assessment to ensure you remain eligible for services. Make sure you work with your case manager to complete this assessment. Talk with them about any assistance you are receiving or need related to daily living. Another important long-term service and support is a personal caregiver. This could be someone you know who is able to become a certified individual provider or a caregiver from a community agency. The caregiver can assist you with things like bathing, meal preparation, and reminders to eat, shopping, and medication management. Sometimes people need time adjusting to their home before they are willing to accept personal care services. There may also be a wait for a caregiver. It is important to keep your case manager aware of your needs and preferences so they can best support you in getting your current needs met. Your caregiver is part of your care team and will work in partnership with your GOSH provider. When you exit a behavioral health facility, you will either be connected or reconnected with a community behavioral health provider. Your behavioral health provider has expertise in mental health care. They work in partnership with your GOSH provider to help you meet your goals and improve your quality of life. They can provide you with counseling and help you process what you are going through. Your behavioral health agency will prescribe and help you monitor your medication. If you are working with a PACT team, they will come to you. If you are working with an outpatient behavioral health provider, most services will be provided in their office. Your care team may include a peer bridger. Peer bridgers work in partnership with GOSH providers to support you through the discharge process and the transition into the community. The duties of a peer bridger vary widely, but they are all based on the effectiveness of assistance and support from people with shared life experience. The peer bridgers use their own stories in helping others develop hope and improve their lives. They assist you in identifying services and activities that promote recovery and lead to increased meaning and purpose. They share their own recovery stories. They promote personal responsibility for recovery. And they serve as an advocate. Transitioning from a behavioral health facility into the community offers the opportunity to ensure you have all the supports you need to live in the manner you wish. It can also be overwhelming to have a bunch of new people working with you all at once. Try to remember your GOSH provider is there to help you make sense of who these people are and what supports they can provide.
Okay. All right, now we'll get a little more into what the GOSH provider works on with our clients. GOSH, in addition to providing the supportive housing services, we provide an ongoing temporary but not time-limited rental subsidy. This rental subsidy mirrors housing choice or Section 8 voucher in the process and the way that it works. The GOSH provider meets with clients, ideally within the first 10 days, to establish some rapport And then one of the first things they begin is the process of filling out the short paperwork to get their subsidy in place. They'll also work on a housing assessment to get a better sense of what kind of apartment, what area the client wants, and what barriers they may have to being able to get accepted for that apartment. Gosh providers then use that information to start a housing search in partnership with the client. And once they find a place the client likes and they've signed a lease, the client will be paying 30% of whatever their income is towards the rent, and subsidy covers the remainder. If a client has zero income, their portion of rent is zero. Every year there's annual recertification for the subsidy that involves a little bit of paperwork and an income assessment to redetermine, what that 30% of the client's income contribution will be. And there's also a housing quality standards inspection of the apartment to make sure it continues to be a structurally safe place to live. Ongoing, the GOSH provider continues to work with the client to eventually find a permanent housing subsidy to transfer to, either through applying to affordable housing that has subsidies in place, or HUD vouchers like a housing choice voucher through the local public housing authority. Until a permanent subsidy is secured, clients can remain on their GOSH subsidy, even if they no longer receive home and community services. They can keep that subsidy. That's why we say the subsidy is temporary but not time limited. We do, try to do that work to get folks transferred to a permanent subsidy so that that state subsidy can go to the next person who needs it as a bridge to that long-term housing solution. But we do not take the subsidy away, or it doesn't expire while a client's using it. Just a brief note, we do have one other pathway for qualifying for a GOSH program right now. It's called our acute care hospital program. This is limited. I believe we received 40 subsidies for acute care hospital referrals. I think we've used about half at this point. So these are subsidies available for clients who are hospitalized. An acute care hospital is essentially just a regular medical hospital, so not a skilled nursing facility, not a behavioral health or a state hospital. They have to be in the hospital at the time of the referral and until the referral has been approved. And if the client's eligible, so they have to also be a long-term care client, functionally and financially eligible for our HCS services. But if they are, then they're offered the support of a GOSH provider to use their subsidy, find housing in the community, and get set up. So they essentially become a regular GOSH client if they want to receive those supportive services. I will say this pathway has been used to help a few of our existing clients who were out, receiving FCS services previously, who became hospitalized, to actually get a hold of a subsidy they could use for their rental assistance. So keep this in mind. If you have clients who are on long-term care services, if you learn that they've been hospitalized, you may be able to help them get a referral to this program. So just something to keep in the back of your mind. Okay, no wrong door. We have no wrong door for referrals to the GOSH program. We have typically received referrals from our long-term care case managers, either those at Home and Community Services or at our partners at the AAAs. The staff at Eastern or Western State Hospital often make referrals, as well as behavioral health organizations or managed care organization liaisons. Supportive housing providers can also bring, like I mentioned earlier, a client that you have, if you believe they may be eligible, you can always contact one of us at our Office of Housing and Employment, and we will see if we can make an eligibility determination. Okay, another little visual here about the GOSH referral process. Again, they definitely have to have qualified for our home and community services, long-term care services. So getting that referral done is the first step if someone's not already on long-term care. This is linked here in the slides, but the way to request an assessment is through our Washington Connections website. It's the same website and application that you'd used for SNAP benefits or healthcare. So a lot of folks are already familiar with that website. You do just need to make sure to indicate that you are applying for long-term care services in that application. But that will begin the process of an assessor reaching out and connecting with the client to get the process going. They'll schedule that assessment. It'll be completed. If they're eligible, then that assessor can make a referral to GOSH if the client has asked for independent housing and seems to meet the criteria. Once we receive a GOSH referral and confirm eligibility, we send it out to a community provider who's contracted with us to provide GOSH services, and they have 2 business days to let us know whether or not they can accept the referral. If it's accepted, then they are going to reach out and schedule some first contact with the client within the first 10 days of accepting the referral. If a referral is declined, we will try to find another provider. Sometimes we go back to folks and ask if they're willing to consider a different county, if we're at a capacity at the client's first choice county. So we really do try to work with folks to find a provider who can start working with them, even if we're required to, look at a different area or different provider. Okay, can we use an interim setting for a GOSH discharge? The answer is yes. So what this means is that when folks are found eligible for GOSH, they're usually still in the hospital. On some cases, the GOSH provider is able to start working with the client right away, and an apartment can actually be in place by the time they discharge from the hospital. I would say that's pretty rare. Most of the time, clients are discharging before the work of that housing search has really been able to secure a lease for the client. So we have many options of where clients can discharge while they're working with the GOSH provider on finding that permanent housing. We have other home and community services settings. So that residential setting can be used as an interim placement. Someone can go to an adult family home or an assisted living facility to live while they work on their housing search. They can stay with family or go to a shelter if that's their preference. Or we have a program called MIST, or Motel for Interim Stays for Transition, which really is a long way of saying that we will put someone in a motel for up to 6 months while they work with the GOSH provider on finding permanent housing. It's the job of the long-term care case manager to seek out and secure the interim setting. So if that's a residential placement like adult family home or our MIST program, that is part of what they do. And the GOSH supportive housing provider continues to work with the client regardless of whatever of these interim settings the client chooses. Okay, so we're going to start to look a little bit at where everyone fits in to the client's team of care when they're on GOSH. Again, we like to keep the client front and center and wrap as much support around them as possible. And our supportive housing providers act as a point person for their client, helping to drive the collaboration across this system of care. A lot of times we see that the GOSH provider is the primary advocate for the participant, the primary person who is working with them the closest out in the community and can really help to make sure that their voice is being heard and what they want and need is being advocated for in this group of different folks that may be working with the client. That can include their home and community services or AAA case manager, their primary care physician, their mental health provider, if they work with employment services, their landlord, and other informal supports they may have. This team of care looks a little different. So before discharge from the hospital, for example, a discharged social worker will be someone that factors into this care team quite a bit. And the GOSH provider, again, will be working closely with that person. So they are advocating for the client around what their discharge looks like, making sure they know when the client's discharging, helping to connect them to PACT services or, whatever support they're going to need out in the community. So we really do encourage the GOSH providers to look at their role as that primary advocate. A little bit closer look at each of these folks that are in our care team. The role of the home and community services case manager, they complete that assessment for long-term care services and usually are the ones sending a GOSH referral. They support any additional long-term care services that the client needs. They may need medication management, in-home caregiver, some of those services we looked at the beginning. They are in communication with the care team, with the client, their providers, and the GOSH program manager. They do approvals and authorizations for any long-term care services, but also resources that may be needed to help with a move. So they are approving requests to use funds for things like first, last, and deposit, basic furnishings on an apartment, things of that nature. So there's a lot of collaboration there between the supportive housing provider and the case manager. The role of the supportive housing provider or the GOSH provider. So pre-tenancy, before a client has moved into their permanent housing, there's going to be a lot of goal and crisis planning, housing search, housing advocacy, looking for an apartment, working with landlords to educate them about our subsidy and advocate for the client and their tenancy. The provider will also assist with a move-in physically. They'll help coordinate that and help with transporting the client and coordinating with that care team, whatever that looks like, and whoever that includes. Once a client is stable in their apartment, the role shifts a little bit. So during the tenancy phase of GOSH, the provider will work to support their tenancy, make sure that they have a good understanding of what their rental amount is, how to pay that they understand any notices they've received from their landlord, that they have a good relationship with their landlord or property management. They can work on building relationships with other people in the community, updating their goal and crisis plans as needed, continuing to coordinate with that care team, working on community integration. That could mean employment for some, or connecting with support groups or things that interest them in the community, getting set up with a volunteer position, or again, whatever client-centered supports make them feel like they are stabilizing in the community and have a chance to thrive. And then ultimately, they'll be working on that connection to permanent housing. Is a little misleading. Everyone that uses their GOSH subsidy is on a lease, but that permanent housing subsidy that is the ultimate goal, so that GOSH subsidy can go on to the next person who needs it. And then the supportive housing program manager, that is someone who works at our Office of Housing and Employment and oversees the GOSH program. They will help authorize supportive housing services. We work on developing and managing our policies and contracts with GOSH providers. We do outreach to try to find and expand our program with new contractors. We provide assistance on our program to providers and case managers, anyone else who needs assistance, and liaise between our state team and the community partners. A new role that we have to offer now, the support of on our Office of Housing and Employment, is a behavioral health supportive housing program manager. So this person offers behavioral health trainings for staff and GOSH providers. They also run a housing supports complex case staffing every second and fourth Tuesday and first Thursday of the month at 1 o'clock. This is an opportunity for any provider to bring tough cases to our entire team to get support and ideas and additional support from this program manager who will follow up and try to ensure that any suggestions or continued support that's needed is offered. So this will also often be used when a client may be decompensating, or if there are a lot of barriers to getting a client into housing and there's hasn't been any success, you can bring that case to our larger group and just get some new ideas for how to move forward. And again, any community partners that are part of a client's care team can help to make a referral, can coordinate with the care team, schedule the client appointments, and help to connect them to other needs, helping with things like medication, discharge planning, and securing transportation out in the community. Here is a look at our team. And we all strive to work together to provide as much support as possible to our providers. And because they're on the ground doing the frontline work with our clients. And we, strive to always be available to support in any way we can. Okay, a little bit of detail on those additional supports that come with the GOSH program. Our clients typically have access to community transition funds through Home and Community Living Administration, and this is financial support for things that help them to stabilize in the community. So again, these approvals all go through the long-term care case manager. A lot of times the GOSH provider is the one that's out in the community identifying what the needs are, and then they work with the case manager to get approval to spend this money on things like background check, first, last, and deposit, essential household items, getting someone set up with basic furnishings, a pantry staples, things like that. They may need access to a cell phone or a bus pass. After the tenancy phase, there may be a need for pest eradication or a deep clean. There's a variety of things that we can help provide to just get that person as stable as possible in their new home. We also have additional supports for our home and community services clients that extend to GOSH participants. If for some reason they were to become behind on their rental portion, we have an emergency rental assistance program, which is a one-time payment of back rent to prevent eviction. We have that motel for interim stay program, the MIST program, which could be used, for example, if someone had a temporary need to leave their apartment, if there was a pest eradication that needed to be done, or some kind of damage to the unit, say your water wasn't working, we could put the client in a motel temporarily while that was being resolved. We offer supported employment is part of our team. If clients are interested in accessing employment out in their community, we can work with them on that. We can provide a behavioral support trainer, assistive technology, meals on wheels, home delivered meals if folks want or need that. and a whole host of other supports. So we really encourage folks to ask for whatever they need, and there's a good chance we have ways to at least connect someone with that support out in the community. Since its beginning in 2017, GOSH has helped over 1,750 participants. We currently have 609 clients actively on GOSH services, and 400 of those are new as of 2025. So we've had quite a bit of increase here in participation this year. Of those who are new to GOSH or on GOSH currently, we have 226 that are in housing and 383 who are in a housing search phase. And then this graph here just shows the makeup of our current participants. Most were discharging from Western State Hospital or Eastern State. We had some diversion clients. Expansion refers to clients who didn't want independent living at first, discharged from their involuntary hold into the residential setting like adult family home, and then later decided within 18 months that they would like to try independent housing. That's what we call an expansion referral to GOSH services. And then our ACH, we have 19 folks that are receiving that acute care hospital subsidy and chose to be on GOSH services. So just a little snapshot of our participants. And we have one more video here with an individual story about one GOSH participant.
If you think of the word house versus home, house, a simple structure, often comes to mind. 4 walls and a roof. Home comes with the ideas of warmth, safety, and stability. The search for a house comes first, and as a person steps inside, it can be made into a home, their home. The search for Anna's home became a journey of its own. Anna is a creative and thoughtful individual with interests in guitar, art, and maintaining a healthy vegan diet. That natural creative spark dimmed during her pursuit of safe and affordable housing. Anna's decision to engage in the GOSH program swayed, but GOSH remained open, ready when she was. When Anna decided she wanted the support of GOSH, Naomi, her GOSH provider, helped find her an apartment complete with an ADA bathroom. I feel safe. I don't feel like I'm in an emergency constantly. It's given me more time to heal. The familiar feeling of urgency arose later when Anna faced a lengthy hospital stay. While an extended hospital stay can cause someone to lose their housing, her dedicated GOSH provider helped her keep her home. While healing looks different to everyone, it's the human experience to face adversity and navigate through change. As part of Anna's journey, she went into crisis and left the area, along with the safety and security of her apartment. During this time, her GOSH team did not waver. The team kept Anna's case open and continued to communicate and collaborate regularly with crisis responders and family members. The team located Anna in a county up north. They reaffirmed that Anna's involvement in developing next steps was critical. The GOSH program and Anna's team would continue on the pathway to safe and stable housing, including providing supports to help community integration and stabilization. She returned to her apartment, re-engaged with her support team, and continued to prioritize her health and well-being, even voluntarily checking into inpatient treatment when it felt necessary. The tethered connection to GOSH helps Anna have more autonomy over the decisions she makes, and with her housing secured, allows her to focus on what matters most to her. One of the key principles of supportive housing is client choice, the choice to decide what setting is best for you. If you are considering the GOSH program, Anna wants you to know, don't be embarrassed or afraid to ask for help. There are resources out there to help you become independent and live on your own. It's a huge support system. Every year, GOSH supports individuals in their choice to live independently in their community when they otherwise wouldn't have the option. The success of GOSH relies on the continued investment from the Washington State Legislature. Currently, the program saves thousands of dollars for the state and provides an important support system for people to enjoy meaningful lives in their community. When an individual finds a house, a simple structure, it becomes a haven for safety and stability. When that individual decides to make it a home, it becomes the foundation for a healthy and full life.
Okay, a little slide here if you're interested in more information about becoming a GOSH provider. This link should still be good, even though it says ALTSA. You can also email me, and I'll be sure to put my email in the chat here. We also have training available. You know, we would love to connect with you or your organization if you need more information. We have a training calendar posted on our website that you can also access. And this slide here has some links to some of our other housing resource information, particularly on our website here for our Office of Housing and Employment. And here's some more detailed information to the policy that drives our programs for those who are interested in that. And that is a look at the statewide positions on our team, which includes me. And I'll go ahead and put my email in the chat here and stop sharing. Thanks so much for everyone coming today and paying attention to my presentation. Are there any questions, Kimberly, that I missed in the chat or that anyone wants to unmute and throw my way?
Yeah, I see one other one that's from Becky. It says, are those in housing search in temporary housing like MIST or at home?
Yes, that probably came up during the number slide. So those folks are mostly in interim settings. So a couple here and there may be experiencing a rehospitalization or a stay in jail, or some kind of institutionalization. A handful of those might be the case there. Everyone else is currently in a lease or in a mostly our folks choose to stay in adult family homes or assisted living facilities while they're looking for housing.
And then some folks wanted to make sure that the slides would be available to them after. So Audrey, could you send those to me and I can get those out?
Yep, I'll put it in a PDF format and make sure all the links work.
Thank you.
Yeah.
I don't see any other questions in the chat, so.
Oh, there might be one there from Aubrey. One of the requirements is that client had to be discharged or treatment centers and mental health clinics considered. So that's a great question, Aubrey. She's asking about our eligibility. So the folks that are on a court-ordered detainment, involuntary treatment, but they go to a community facility, those are the folks we consider to be diverting from a state hospital. So to answer your question, yes. The key factor for eligibility is that unfortunately for our program, people who are voluntarily seeking treatment at those facilities are not eligible. So there does have to be that court-ordered treatment. And then Becky says, are there enough openings in AFHs and ALFs to meet the demand for interim housing? I have not found that to be an issue, Becky. I have occasionally it's difficult to place a client with a lot of barriers and maybe they have a violent criminal history. You know, the adult family homes, they can choose who they work with and don't. So occasionally there'll be someone that there are a lot of barriers to getting them placed, but generally, I haven't found that to be an issue, like as in terms of general capacity. And then we do have the MIST program as well. So any motel that's willing to, work with our providers for payment on behalf of the client can be used. Oh, and then I'll put my email in the chat here for anyone that thinks of something else. And I'll make sure that I send these slides, Kimberly, to you.
Yes, please.
Okay, great. Well, thank you so much, everyone. Have a great day, and thanks again for coming.